My name is Maria Bison. This project is narrated for George Mason University, Health Informatics and Data Analytics, organized by Dr. Farouk Alimi. Diabetes is a complex disease that, if poorly controlled, increases the risk for cardiovascular disease, neuropathy, retinopathy, nephropathy, and other medical conditions. It is often preventable, but it is also the seventh leading cause of death in the U.S. There were 28.9 million Americans had diabetes in 2012. The cost to treat diabetes ranged from $13,000 to $21,000 annually for each Medicare patients. These findings calls for improvements in data collection and diabetes screening and management, along with policies that support these improvements. The data source for this project is a simulated data from a major healthcare organization in the US. Data size is over 17 million records merged and compiled into MS SQL Server. After normalizing the data, there are over 5 million records, of which 348,821 are unique. The data set are ICD-9, patient ID, age at diagnosis, age at first DM, and age at death. According to Centers for Disease Control and Prevention, diabetes is a serious, chronic, lifelong condition in which the body can't properly control the level of sugar in the blood. There are two types of diabetes, type 1 and type 2. Type 2 diabetes is the most common form diabetes. In the United States, there are 84.1 million adults, more than 1 in 3 have pre-diabetes. Age is used as predictor to predict diabetes. This graph shows the number of people diagnosed with diabetes increased after the age of 40, with median age around 60. This table shows the sample of obvious predictors in which the diagnosis always occurs with diabetes or have the word diabetes in their name but were not used as the definition of diabetes. These are the sample of rare diagnoses as predictor for diabetes. Nephritis has the odd ratio of 7.285. After manipulating and calculating the data, the results showed the top 10 most predictive diagnoses. Here, hypertension has the likelihood ratio of 1.053, followed by hyperlipidemia, GERD, DM2, tobacco use, and so on. Naive Bayes algorithm is based on probability model that incorporates strong independence assumption. It can be used to aggregate data from individual diagnosis to overall risk for diabetes by calculating the probability and likelihood ratios and divide it by prior predictor probability. Several authors found naive Bayes algorithm fast and easy because it is not complex as most algorithms. This is an example of a patient with 5 diagnoses. Here it shows the likelihood ratios of each diagnosis and its corresponding odd ratio. This code allows me to look up any patient ID, identify their diagnosis and likelihood ratios at the same time. 20% of the data was set aside to cross-validate the testing. This table shows the predictors did not have any significant change. Hypertension and hyperlipidemia remains the top 2 predictors for diabetes. The receiver operating curve was used to test the accuracy of the prediction of diabetes by plotting the sensitivity against 1 minus specificity. The accuracy is measured by the area under the ROC curve. In summary, the predictive model that I built can be used in screening for diabetes and other diseases. For instance, I can look up any patients who has more than 5 diagnoses, or I can look up any patients and see what their diagnoses are and what their likelihood to develop diabetes. This model can be integrated into the EHR and use it as a tool to screen for diabetes.